Hey guys, I'm 9 days post-op, and I got the nipple sponge things off yesterday, and I just took my first shower in 9 days, um, so I'm feeling nice and good. I'm airing everything out, and I thought I would just show you my chest. So I guess I'll do that first, and then I'll talk about other stuff afterward. This is my chest. 9 days post-op. It looks really good, and the lady who took the sponges off and everything said that my nipples look like amazing for only yesterday was 8 days for only 8 days post-op. So when she took them off, like the nipples like looked almost as if they were like caved in, um, but they popped out today when I took the bandages and stuff off. But there's my chest. It's still a bit swollen, um, and everything. The scar goes back to there. Um, the scars are really raised. They took the tape off the scars yesterday as well. Nothing hurts. I'm getting little like pings of like like stinging just randomly along the incisions and like kind of on the nipples, but not really because I can't feel them. But like I'm getting weird little stings everywhere. Um, but yeah, like they look really good. Um, he did make them a little bit smaller. They look to me like a lot bigger than they did pre-op, but I know that's only because now they're flat and they're dark right now because of the scabbing and stuff. But I'm really happy with the size. I'm happy with the placement of them. Um, but yeah, you can see the swelling on this side is still pretty nowhere near as bad as it was. Like this is really good compared to what it used to be like. But you can see the bump there. There is swelling on this side as well, but just a little tiny bit. Um, I have full feeling on like this armpit and all of this. This side is still numb on the back of my armpit, and like my back here is still numb, but it's slowly coming back and it feels like kind of like a bruise around there now. But everything feels good, everything looks good. Um, so that's what that looks like. Um, I'm not going to do a close up of the nipples because that grosses me out. Um, but yeah, I've never heard anybody talk about it before, so I was like, I didn't really know what to expect. I figured out that the sponge things were like sewn on to me because it looked like the skin was pulled up, like it looked like it was sewn on, but I had never heard that before. Like nobody talked about that. Um, so the sponges are sewn on, which means they have to unsew them when you get them off. So they like cut all of the stitching and then pull the sponge off. You can't really like you feel tugging, but there's no pain because you can't feel your nipples. Um, and then they ripped the tape off, and that hurt a tiny bit, but nowhere near as much as I thought it was going to, um, because you can feel the incisions. Like those aren't numb. Like I can feel that. But yeah, what feels weird to me is things touching my nipples, like when she would, because like they ooze stuff and everything, which is normal. Um, so after she pulled the sponges off, she like dabbed or like patted my nipples with a cloth to get all the nasty crap off, and that felt weird, and I didn't like that at all. So I didn't mind the pulling the stitches out, but the dabbing, I didn't like that. So basically, what I'm supposed to be doing is wearing um, gauze that they gave me. They gave me a whole stack of it. Um, and I had to go out and buy polysporin, and this is polysporin ointment, not cream. You can't get the cream; it has to be the ointment. She said, and she had some of this, and she did the dressings yesterday to show me how to do it. And then I went out and I went to Walmart and bought it. It was like $8 or something. Anyway, you put a dab of polysporin on the middle of the gauze, and then you put the gauze like just over the nipple, like there, and you're supposed to put the giant gauze thing back around and put the binder back on. I'm not for that. I haven't been wearing the binder really. I've only been wearing it to sleep the past like 4 days, not including yesterday. I was supposed to be wearing it like all day, every day. I stopped wearing it by like the fourth day um, because it was hurting me, and it was so uncomfortable, and it was doing more harm than good. I didn't tell them that, but she said my chest looked great, so it wasn't like I didn't mess anything up by not wearing it. Um, so basically, I decided when I went to Walmart to get the polysporin, I went and grabbed some medical tape. This is just a Walmart brand, like Equate or whatever. Medical tape. This was like $1.50 for the whole roll. It's clear adhesive tape, um, and I'm just taping the gauze. I'm taping it above and below. And since that gauze is so big, it doesn't touch the scar, which is good because or the incision. I didn't want to put tape on the incision. So I tape like here and here. I don't tape the sides. And then I'm putting a tight undershirt over top to just give a little bit extra, um, just to make sure that if the tape, for whatever reason, moves a little bit, that it stays in place. And then I put a regular t-shirt on over top of the undershirt. So that's my solution because I'm not putting that binder back on. It's hurting me. I don't know why it's hurting me, but it is, and it's not even tight either. It's the fact that it's like it digs into my armpits and it makes me stiff, so it's hurting my back because I can't walk straight and I can't sit up straight when it's on. And then it's also like um, restricting my movement, which is making my chest hurt. So um, yeah, I can't wear that thing anymore, so I'm not doing it. Um, yeah, and we'll see what happens when I go back. I have an appointment for like 2.5 weeks from now um, to go and check because I have to do the nipple. Like I have to put polysporin on the nipples and have them covered for 2 weeks, which is fine. And that way also I don't have to wear the binder outside the house because I am going out now. I'm going out places and like I can't be in public with that thing because it's bulky and I can't walk right and it's just ridiculous. So um, I had the whole like apparatus that I made up with the tape and the shirt yesterday, the whole day, and I wore it all night. And then I woke up this morning and I took it off all to shower, and like everything was still in place and everything was fine. So um, yeah, like I don't see the point in wearing that binder at all for another 2 weeks. That's ridiculous. So that was my solution. Yeah, I think that's it. Oh, also, I forgot to mention this is just a random little fact, but I didn't know this, and they told me and my parents this like right after I had surgery. Um, they said that like they take all the breast tissue and fat and everything, and they send it to a lab just to test to make sure that like there's nothing else in there that shouldn't be in there. And then they put it in the incinerator and they get rid of it. But that's a little fun tidbit of information that they test all that stuff. Yeah, but anyway, here's just one last look at my chest. I am so happy. Like I'm having a hard time putting my shirt on because I just don't want to. Um, I just feel so good, and it looks so good. It looks better than I thought it would, and like my mom is so happy, and she says it looks amazing, and it's just really good. So thank you for watching. If you have any questions or comments, um, ask away because I mean I'm just sitting here doing nothing, so I might as well answer your questions if you have any. If you're going to McLean, you have any questions about the clinic or anything, then just let me know. Yeah. Subscribe if you haven't already, and thank you for watching. See ya.